All right, welcome to the High River and District Healthcare Foundation social media. I'm Jody Seeley, and it's that time of the month again for another healthcare conversation. And this month, our topic has been caring for the caregiver. And I don't know about you, but I instantly have people that pop into my mind that fall into this category that I've been thinking about as we've been sharing this content this month. And so I'm hoping that that's been really helpful for you. And we want to take a moment and have a conversation today with a couple of, I'm going to call them experts in the field of supporting caregivers. And so we're so happy to have Sherryl Gehring join us. She is with the Adult Day Program, and also Krista Davidson, who is with Home Care in High River. Ladies, thank you for being on episode number 8 of our healthcare conversations.
Thank you for inviting us.
It's good to have you. Are you staying cool in these crazy heat?
Yes, trying to. It's been a bit of a challenge, but that's okay. Summer's short, so we'll take it while we get it.
Yeah, no complaints whatsoever, just tips and ideas. But when we talk about the topic of caring for the caregiver, I would love to hear what sort of pops into mind for each of you when you hear that phrase, because I know that you probably experience it on a much different level than what we Google and search or maybe experience on our own. So Sherryl, let's start with you. What does caring for the caregiver mean to you?
Well, through the Adult Day program, which is what I'm representing, we see caregivers that are often really struggling with their caregiving journey. You know, they're experiencing caregiver stress on a variety of levels for a variety of reasons. And you know that they just need to be looking after themselves. So I know something Krista and I have always shared with the caregivers that we support is that. You're only going to be as effective in your caregiving role as you are in caring for yourself. So you need to really be aware of your own wellness. So it's always just being aware of those caregivers and their own personal wellness.
Krista?
I tend to agree with Cheryl and that we have to make sure that the caregiver is taking care of themselves because they're essentially the most important person in that situation because without them, the person they're caring for would not be able to be in their home. We also need to remember that the most common caregiver is a family caregiver. It's typically a family member. So making sure they have access to supports and resources in the community to know that they're supported in that role.
Would you say one of the biggest hurdles that you see come in front of a caregiver is, I don't know if it would fall under something as simplified in title as managing their time for that, because I think that when you're busy caring for another person, it's really easy to not leave any time to care for yourself. Would it be that, or what do you think is the biggest hurdle for people?
I tend to think that they don't leave time for themselves, and sometimes they don't know what supports are available, like connecting with home care and even getting respite in for 2 or 3 hours, or having their loved one go to the adult day program so they have a day where they can focus on what needs to get done. Because not only are they caring for their loved ones, they're grocery shopping, they're doing laundry, they're housekeeping, they're paying bills, they're doing everything involved with running a household and caring for their loved ones.
Yeah, I absolutely. I think time management is essential, but it's a challenge because a lot of times these caregivers are so overwhelmed. They have so much on their plate. You know, they have all of their own responsibilities and now they have someone else's as well. And they need to try and fit that into a 24-hour period each day. And so a lot of what we try and encourage is that respite factor. You know, whether it is by having their loved ones come to an adult day program where they get a 5.5 hour time span where they know that the person they're caring for is going to be in a supported environment, provided with nutritious meals, therapeutic recreation activity, nursing surveillance, or whether, as Krista said, it's home care providing respite in the home where the caregiver can then go out and maybe run some of these errands, do some banking, do some grocery shopping, take care of whatever maybe needs to be done. And it just helps balance that time time a little bit, because caregivers can't always take the person they're caring for with them to do these things. So respite programs are essential. But to build on that, as Krista mentioned, often caregivers are family members or spouses, and so they also need to tap into their larger connection, their larger circle, and reach out to extended family or the larger friend circle, places where they can get maybe some support to help them manage and not be afraid to delegate. A lot of times caregivers, they're reluctant to ask for support. They feel that they need to be doing this themselves. They're strong, they're capable, they shouldn't have to ask for help. They don't want to inconvenience anybody. Whereas that's the absolute opposite of what they should be doing. They should be reaching out to these support networks to try and help them manage their time management and balance some of these responsibilities.
Well, as we have this conversation and throughout the month when we were researching some of the content that we shared to give people the tools and tips and tricks to do it felt very comparative to me. And I mean no disrespect when I bring this up, but it sounds so comparative to me of parenting, right? And if you think about, if we put maybe into perspective for people, that if you knew someone who had a new baby or had multiple kids, offering to take the kids, to give that space, to do that thing, is so similar, but we don't put it in the same category. I don't know or why. Maybe it just feels a little bit different because it's usually an adult that you're looking after as a caregiver, but it can often be a child or a person with a disability as well. But when you kind of look at it at that perspective, it feels a little bit more like, well, yeah, why wouldn't we give someone a break or extra support, or what that looks like? Does that make sense?
Mhm.
Absolutely.
I think the difference with the parenting piece, when say it is an elderly couple, you've already raised your children. Yeah, you've moved on and moved out, and now you're caring for your adult spouse and having to help him go to the bathroom, having to help him shower. And then there's some resistance sometimes from the person you're caring for because they're not accepting that they can't do it.
Right.
So they're hitting more hurdles, I think, because they're kind of coming to blows at times because the person you're caring for is not happy that you're having to do this, but they also recognize the need.
Yeah.
So it can cause a little bit of dissension and conflict amongst couples, or
yeah.
So it's a little
Exactly.
more tricky. And with the pandemic, it even increased
Yeah.
what their roles were and what they had to do.
Yeah. And in some cases too, Jody, it's the child caring for the parent. So now you've got a complete role reversal. And like Krista said, that's a difficult place to be because you raise your children. You're the care provider. You're the one that is helping them with their needs. You're the one that is doing that caregiving role because you are the parent, and that is the nature of things. We are nurturers of our children. We raise them. And then when that role reversal happens, it's not it's not it's not that natural progression of how things are supposed to go. And so it's not always comfortable. Some children aren't comfortable, in a caregiving role, but then they find themselves there having to make the best of it and doing the best that they possibly can in a situation that they maybe never expected to find themselves in. These aren't things that we can ever predict, unfortunately. So that's another challenge.
Well, and let's dive into the two programs that you guys are representing today, because I think these although you've alluded to them, make really, I don't know if everybody knows all about them or that they have access to them or what that would look like. And in situations where you've given examples of family members who maybe feel uncomfortable to ask other family members or what that looks like, knowing that you have a professional coming in to offer that respite or that break or that assisted help could maybe be a really great solution. So Sherryl, let's start with the adult day program and just kind of give us a little synopsis of what it is.
Yeah, for sure. It is one of those kind of best kept secrets because unless it's something you've been directly faced with where you've had someone who's needed that service, it's not something that's just out there. Chances are you've never heard of it, you don't know anything about it. So a lot of people find themselves quite pleasantly surprised that there is a program like Adult Day program that can provide some support. So essentially our clients have to be home care clients. So we are a home care program. And we operate in 5 communities in rural South Calgary, and we have various days of the week that we operate. Essentially, it's a respite program. Providing respite for caregivers, but it is also for people who are just living independently in the community, but are maybe socially isolated or are at risk because of their physical or their mental health. But for the respite, the caregiver portion of it, it allows an opportunity for that caregiver to bring the person they're caring for to us in a group environment where they are supported by 2 staff. Our programs are facilitated by a licensed practical nurse who kind of oversees the health monitoring component and is also that liaison to their home care nurse. And then there's also a recreation therapy assistant, which is the other part of the program and probably the bigger bulk of the program. It is hugely social recreational by nature. And so we offer a wide variety of activities that are geared to meet a wide range of needs. People are admitted into the program. It's a diverse group, so it's not based on any specific age or diagnosis. So, we are able to meet a wide range of needs, in this group environment. And so it gives that caregiver, 5.5 hours. We operate from 9:30 until 3 o'clock and provide snack and meal during that time as well. And so 5.5 hours where that caregiver can go out and either do some self-care, something for themselves, engage in their own recreation, leisure, social activities, or maybe run errands and do something that they need to do in terms of their, scheduling and other responsibilities. So that's basically how our program operates. And a person can access 1 or 2 days a week, depending on need and what works best for their situation. But basically that is how Adult Day program operates. It's what we do. We run year round. We generally only close for statutory holidays and inclement weather. But other than that, we're usually going year round. Most communities, rural communities, have 2 or 3 days a week. We saw a huge shift when we did go through the pandemic, and so we are still in somewhat of a relaunch back into our normal, uh, you know, uh, structure for Adult Day program. But we are available, we are here, and people can contact me directly, even if they're just looking for information.
All right. And how should they do that, Cheryl?
So I can give you a phone number if you want to take. My direct phone number is 403-652-5440. That is my office, and my home base is in High River. But like I said, we represent all of rural South. So we are in Turner Valley, Okotoks, Nanton, and Vulcan, as well as High River.
Awesome.
And if people are already a home care client, all they need to do then is just talk to their case manager, who is their RN, and they can give a direct referral to us. But the biggest thing is to access it. An individual needs to become a home care client.
Okay. Perfect. Thank you for that. And Krista, give us the spiel on yours.
Well, I don't really have
Your
any.
turn. Yeah.
I'm like, well, how do I explain mine? Well, being that I'm the social worker, I tend to go into people's homes at the request of nursing to kind of give some tips and tricks on coping and different strategies when working with their loved ones. I also will often refer to the Adult Day program. A lot of times there's hesitation from the client to go to the Adult Day program. Well, I'm just not that social. Like, I don't think I do that well in that setting. And then they go and they love it.
Yeah.
So I think, and the nice thing with my role is I can connect the caregivers to other supports in the community, like family community support services, helping them do applications for housekeeping, transportation, anything that they may need in their home. that can make that what they're doing easier on them. So just giving them the local resources available within the community, like Meals on Wheels. If cooking is becoming too much, then how do we access this program, or Heart to Home? And there is a lot of volunteer transportation and all of that stuff that they can access that they don't really know about it, because we just don't. It's not always in places that they are.
Yeah.
And it's not like we're sending letters each month saying, did you know this is available? Which would kind of be nice, but FCSS is probably one, Family Community Support Services is probably one of the best places for our caregivers to go to learn of what resources are available.
Yeah.
Because our local FCSS works quite closely with most seniors programs.
And they're just the most amazing team in that office. So
they are.
Just going to visit them to say hello is worth the trip to that office.
Well, and then they have all the resources right there.
Yeah.
And they will do direct referrals to me as well if it's required. So
yeah. So how do people access you, Krista, or does that come by a case-per-case basis? Like, are you more assigned to a case, or are you someone who people could connect with?
Well, in rural, where I can be a case manager, meaning they don't have to have a nursing need to connect with me. They just need to fit the home care profile. So sometimes I will get the referral before nursing gets the referral for me to go out and see what the situation looks like. And then I can pull in all the resources. So again, it would be calling the main office or going through community care access to do that referral to me. So for community care access, say even if it's just caregiver burnout, they would need to call 403-943-1920 and request a social work consult. Or if they wanted to connect with me directly, they could call 403-652-5445.
Okay, I'm just writing those down. Okay, hang on. So this one is community, like the part of being live. Yeah, we're just going to talk to ourselves while we type, because that's what we do normally. Community care access, and then we're going to put up, and all of these will be posted below the video as well. So if you're listening while you're doing something and you're not able to write it down, we have it posted for you.
And it's the same for adult day program as well, Jody. So it's the same community care access number. And much like Krista, an individual doesn't necessarily need to have any other acute nursing needs. They can come on to home care just for the purpose of accessing adult day program services. And so they will still be assigned a case manager who will ultimately oversee their care. But I always encourage our clients, I say, that's not necessarily a bad thing, because once a person is linked with us, it means they're already in the system and have immediate access to other services like Krista and social work. Or if they do all of a sudden have an acute nursing need, they can have the home care nurses going out into the homes, or they can be connected to physio or occupational therapy, or such a wide range of services that home care can provide. So it's kind of a win-win. You can be connected to one, or you can be connected to all. And being on the inside just means you have access when it's needed.
Well, and I feel really so called to share in that just get access. Just call and start that process, whether you're in the place where you really need it now or not, but just knowing, and these supports are here for a reason. They're here to give people access. So just don't feel like, oh, we'll be okay, or we can do it on our own, or all the humble things that we do as humans to push away some of that support. We live in a country where we have beautiful social services, so let's use them.
Yeah. And a lot of times the greatest challenge is just not knowing what's available to you, and, that's a big part of what Krista and I do through Caregiver Support Group is it's just trying to provide resources to caregivers, because a lot of times they just don't know what's available, even through home care. They know home care exists, but they think they have to be rehabilitating for something, or they have to have a wound that's being addressed, or, they don't realize that there are so many other things that home care can assist them with, that can support them, and, especially with caregiving.
Yeah, I feel that like home care automatically, I think you need the slogan like more than bandages. That's
Yes.
automatically what comes to mind with home care too. Is like, oh, well, you don't have an open wound. Like,
Yeah.
how often is that? So
Right?
yeah, more than bandages, they're here to help. So the support group itself, how do people access being a part of that?
Well, the support group, based on the pandemic, has been placed on hold.
Okay.
We are optimistic that the group will be operational in the fall.
Yeah.
So we're already in the works of, we've found a place. So really, we're going to have brochures. So you don't have to necessarily be a home care client to access the program. However, when you do come to the program, we will make you a home care client, just so then you're part of our system.
I love
So once we get those brochures, we will be handing them out, and maybe we can do something like this again to announce that the program is back up and running.
Yeah.
You bet. We are here for you to come and share our platform and share that information. So once just email me and we'll do this again. And thank you, ladies, so much for your time today to talk about this, to share, to keep that conversation going. And I hope that more people will reach out and access the supports that they have and not worry about that somebody else. I think the other biggest thing that comes to mind that we've seen so much in any sort of aid program is that people think, well, somebody else could use it more than I could. And do not let that comparison be your stealer of joy, because there's room for everybody.
And it's all relative, right? Depending on your own situation. So, and I just also wanted to add, Jody, that Krista and I previously were co-facilitating the caregiver support group within High River together, partners in crime, have been for quite a while. And previously it was monthly, it was once a month. So it will likely go back to being once a month. It will be at a location right here in High River in the community. And we certainly will, we're working towards it. Krista and I keep saying we're optimistic that we are going to be able to relaunch this back in person. We did actually try to do it virtually when the pandemic first started. And Krista and I were like, gosh, we know these caregivers need to be supported. How can we do this? And so we tried the virtual platform and we had a few Zoom meetings, but for our particular participants, it just wasn't a platform that was really, it just wasn't effective. It wasn't overly successful in meeting their needs. And some of our caregivers just simply didn't have the technology or access to it or felt comfortable with it to be able to do that. So we've been reaching out, Krista and I, other ways, via phone and, and now meeting one-on-one in person and that sort of thing to continue to provide that. But we're very much looking forward to being able to go back to that group environment where it helps when they can share amongst themselves and get support from each other. And then they really realize that they're not alone on this journey. And even though everything they experience is a little bit different, they still have the same common goal.
Yeah, I love it. Well, think of how often in a group setting, somebody has found the answer to a challenge, whatever that might be, that even you as caregiver practitioners might not have thought of, that somebody's like, oh no, like do it this way and try it like this. There's such value in that connection. So I really hope you guys will be able to be up and running in the fall also. And we'll keep everybody posted and just, keep reminding our beautiful caregivers, like there is no more beautiful job than that of a caregiver, whatever that role looks like. And so we just send you out so much love and strength in your community. And we invite people to share this video onto their social media, because you never know where there's another caregiver in your group who is needing to access this support. So let's share the love today. Awesome. Ladies, thank you so much for your time. Appreciate it. And good luck with the program in the fall.
Thank you, Jody.
Thank you.